Gold participants from around the world. I'm Kristen Schwartz, licensed midwife and MC for Gold Learning. And I'm chatting here today with Heather Pierce about her upcoming presentation, Pelvic Floor Health, Pregnancy, Birth, and Beyond. Welcome, Heather.
Thank you.
It's so lovely to have you here with us today and answer a few of our questions. But so before we get started, diving into the topic, can you tell our listeners a little bit about yourself and your professional journey?
Yes, thanks, Melissa. It's lovely to be here, and I'm feeling very privileged to be asked to share something that I'm very passionate about. I first got involved in childbirth, things around childbirth, nearly 25 years ago when my youngest, third daughter was born. And I started taking childbirth classes at that stage and realized how much there was to learn in terms of understanding what a pregnant woman goes through and her own journey through the pregnancy and birth process, and also wanting to help women recover and maximize their potential physically during that time as a physiotherapist. I found that fast forward to 2006, I was working in a very busy acute maternity hospital in Sydney. We had over 5,000 births per year, and as a physiotherapist, I was very often involved in the care of women who experienced trauma during labour, around birth. And if for want of a better word, picking up pieces around the pelvic floor. And this is when I decided to enter into the midwifery profession. I felt that becoming a midwife would really help me to understand the process, understand how things occurred, how the injuries occurred, and this is where my professional journey started in midwifery. I continued my physiotherapy, working in women's health, particularly around pelvic floor rehabilitation, but at the same time, as a student midwife, I'd be with a woman helping to birth her baby one day, and then the next day I'd be a physiotherapist helping her to understand how to maximise her recovery if there'd been any pelvic floor issues around the birth. So that's kind of where I've come from.
That's a wonderful combination. Midwife, you're birthing, you're helping her assisting her at the birth of the baby, and being there next day for recovery. That's the way to go. That sounds wonderful to me. If we think of pelvic floor health, which is such an important topic, if I look back in my midwifery school days, and I think I'm not only speaking for myself, but for other midwives and birthing professionals, we learn, about the pelvic floor muscles. We learn in school about them, and we learn about them, when we need to suture. But other than that, there's really not much information out there. So wouldn't you agree that there is not enough? And what can you tell us a little bit about that?
Yeah, well, I totally agree. I think sometimes as professionals we can be in silos. And after completing my midwifery degree, I was privileged to enter into an honours program. So I did a midwifery honours, and one of my supervisors was Hannah Darlin, the other one, Professor Carolyn Homer. And with that program of study, I really recognised how important it was to communicate between professions. And having studied a direct entry Bachelor of Midwifery, as a physio who had a background in anatomy and physiology, I just couldn't understand why there wasn't more on the pelvic floor. Knowing and understanding that it's around humanities and keeping birth normal and protecting, putting the woman first and protecting her ability to choose and have a normal birth. But there was more in terms of being a little frustrated around how there's another world out there that is looking at long-term effects of childbirth and looking at it as a risk and quite negatively. So I really wanted to improve the communications between physical therapists and midwifery and those who are really wanting the best outcome for women, and to try and go about that so that we can both work together. And as part of that, I did worked, as you said in the introduction, on a course for midwives through the Australian College of Midwives on learning more about pelvic floor health and what we can do as midwives to help women who we're
That sounds
caring
really
for.
good to me. You mentioned, yeah, we are often as care providers operating in isolation, and improving communication and education to keep birth normal is so very important. And thank you for helping us with that, and doing this presentation here for us. I have time for one last question here today. Um, what is it that you like our attendees or participants to take away from this presentation? Just without giving too much away, of course.
The main thing I think would be to have an understanding of anatomy and normal function. When you understand how things work normally, and that's through the life stages, so not just through pregnancy, but as we grow older, as we all do, get older, and continence is such a topic that is not often well talked about. It's an intimate. It can be embarrassing if you leak urine, if you have problems with your bowel, your back passage, if you have a prolapse. It's not necessarily something you even tell your doctor. And so I think if we have an understanding of the normal anatomy and physiology and the risk factors that go towards having dysfunction, then perhaps we're more likely to talk about it. And I'd love the midwives and the other healthcare professionals in the audience who are passionate also about this topic to talk about it more, not necessarily as a risk in terms of pregnancy and the negative effect that may have on your pelvic floor health, but rather to be empowered to keep things as normal as possible and to walk away with the best outcomes.
That sounds absolutely fascinating to me. I can't wait for your presentation, Heather, and thank you so much for
Thank you.
spending time here with me today. To our listeners, Heather Pierce's presentation, Pelvic Floor Health, Pregnancy, Birth, and Beyond, is part of our Midwifery Conference 2018. For more information on this presentation and on other presentations in the Gold Midwifery Online Conference, please visit goldmidwifery.com. Thank you all for listening, and bye bye, everyone.